So to our first presentation, I call upon Professor Mary Vahter from the Karolinska Institute to address us.
Okay, thank you so much, and I'm delighted to be here talking about, I think, a very neglected research area. And if I can have my slides, please. And that is about sex and gender issues in toxicology and environmental medicine. So are men and women equally susceptible to environmental pollutants, to all the thousands of chemicals that we have around us? I think it has been a general belief that women are more vulnerable also to chemicals than men. But there is very little scientific support for this idea. And I'll show you some examples in these presentations that will be very summarizing. Looking at the life expectancy, you should almost believe that it's the opposite. Women live longer than men. One example, though, that I'll take right away is the Itai disease that appeared after the Second World War in rural areas in Japan, where they have emitted polluted water from the mountains, from the mining areas in the mountains, to the rivers that were used for the rice fields. And it was mainly women who were struck, I would say, by this cadmium that came from the mines. They got multiple fractures, osteomalacia and osteoporosis, immense pain. And it was rather quickly discovered that this was due to this pollution of cadmium, a very toxic metal. However, I mean, this was known then around 1960s at least, and we didn't really consider it in the risk assessment. It was claimed, I say was claimed, that these were poor women, these were malnourished women, they had many children, so probably they were more vulnerable because of that. And then it was more or less forgotten. It's first today, just the very last few years, that we have taken up this research and see that cadmium, even at the exposure levels that we have in the general population, also here in Europe, affects the bone health, increasing the risk of osteoporosis, which is rather frequent in women, particularly in the Scandinavian countries. Some years ago, around 10 years ago, there was a boom in this area. It was discovered that there were some chemicals that could affect hormones, and it was described as gender-bending chemicals. And it was shown particularly in the environmental toxicology in fish that they could change the sex. And many, many men became very worried. And this started a lot of extra funding. It was amazing that there was, all of a sudden was much more funding for research. And first, I would say the very last few years again, we have started looking also at women. What does these now called endocrine disruptors also cause to women? This is a little the results of the research. It has been shown that some effects in men, like the sperm quality and amounts, hyperspadias, and so on, increase much, much more than can be explained by something else than the environmental factors. And I think this slide fairly much good represents the gender balance in this type of research so far. I hope that the top right slide will be followed by much more research. I think it is important, and I'll show you a little why. Some years ago, in 2005, the Swedish government put a question: are women equally protected against adverse health effects of chemicals as men are? And they put this question to our chemical agency in Stockholm, and they asked us to try to give a good answer to this actually very important question. Since I had been doing some research and writing some review articles on the toxicity of toxic metals, I took the lead, and I was coordinating this review of the literature in this area. And to our surprise, I must say, we found very, very little data. This is more or less a black area. Many studies, many of our standards for chemical are based on studies of occupational exposed people, and those are often men, has been anyhow. Also, experimental studies usually use male animals. I have to confess that I did my PhD on arsenic toxicity using only male mice, rats, and rabbits. No one told me that it should be something else. In vitro studies using cells are mainly, if at all described, coming from male animals or humans. And I went through all the dissertations over the last years at our department and found that that was really the case, but often it was not even mentioned where the cells came from. When they do the toxicity testing, they have to, according to the regulation, use male and female animals. Cancer studies, for example. But amazingly, it's seldom evaluated. The data are there, and I'll show you in a minute. And the second bullet, when we are now coming more and more to study the general population, there are both men and women exposed out there, and they are studied. But in the epidemiological studies, the default is to adjust for gender or sex rather than looking at it. So you adjust for it, meaning that you consider or you take away if there are some differences rather than studying it. So in this report, anyhow, we went through where different areas of toxicology where there could be, we could expect to see gender differences. And I will give you some examples. Some first very well known, that nickel allergy mainly is more common among women, I should say, than among men. Not because probably women are more susceptible, but because we have been more exposed to buttons, and cheap jewelry that contains a lot of nickel. If you look at the younger age groups in this slide, I cannot point, unfortunately, you can see that among the 20 to 40 years old, there is increasing also among men now due to all the piercing and maybe all the tattooing, that many of these colors that amazingly people put into their skin or under their skin contains a lot of metals. Also, smoking is a good example, well known, that 50 years ago or so in Europe, there were very few women smoking, but now there are equally, or even among the young people, there are more women than men smoking. And this has to be considered. We have to consider this smoking and this difference, this variation over time in all the studies that we do because smoking is so influential. I'll go to some examples now, taking it mostly from my own research. This is the cadmium that I talked about in the beginning from the tie disease. This is the cadmium concentrations in blood. And you can see that in younger women, it's much, much higher than in men. This is due to cadmium hitchhiking with the iron transporters. So on the x-axis, I have serum ferritin, which is the marker of iron stores in the body. And when the iron stores go down, which is much more common among women than men, because we lose a lot of iron with the menstruation every month, then the body upregulates the transporters for iron in the intestine and takes up more iron and, unfortunately, also cadmium. So you see, at low iron stores, there is a steep increase in the cadmium concentrations. But it's never so simple. There is also, when we did studies on twins, homozygotic and dizygotic twins, comparing them, we could see that there is also a major genetic factor for cadmium in the blood of women. Going now over to the health effects and the toxic effects, we can first see here that this is the cancer incidence rates. I've taken the US data that has been published recently, and you can see that men get more cancer than women. Here you should note that women are the gray, almost invisible line at the bottom. The red one is the average of the two. So that is true. And recently, after we had done this investigation, this report, some colleagues of mine started to look at really the toxicity testing data. And they went through the cancer studies in the US National Toxicology Program, it's called. And you can see that in 201 of 278 chemicals tested in this program, they had 6 differences in 1 or more organs. And in 468 of the chemicals, there were tumors only in the male animals, and only 19 chemicals gave more tumors in the female ones. And you can see the male tumors were mainly in the pancreas, more than 60 times more than in the female animals. While at the top, the lung showed more tumors in non-smoking rats. We have done studies on, I'm an arsenic person, and I've done studies on arsenic, and we have done it mainly in Bangladesh, where many, about 5 million of the 10 million tube wells that have been constructed over the last 30, 40 years or so, partly from our aid organizations, contain far too much arsenic. They didn't test for it. And we looked at the skin effects. That is an early effect of arsenic poisoning. you get hyperkeratosis, particularly on the hands and feet, and pigmentation changes. And as you can see, it's more common among men than among women, after I really convinced my colleagues to really study it. We found this. And when I went back in the literature showing the small diagram down to the right, it's apparent from studies, previous studies, that also skin cancer from arsenic appears more commonly in men compared to women. Another example for the opposite is second-hand smoke. I talked about smoking before. This is those that are around the smokers. And it was recently an article in The Lancet showing the worldwide effects of passive smoking or second-hand smoke. And you can see that the deaths are more affecting women, than men. And looking at daily disability-adjusted life years, it's mainly the children. So it varies depending on the chemical, the exposure, and probably the situation. Of course, women in certain circumstances are susceptible, or because during pregnancy there is a transfer of many chemicals over to the fetus. And I don't expect you to read this complicated. I just want to point out the extremely complexity of child development, all these different extremely sensitive changes that happen and that will result in a healthy baby. You can just see that there are small, this is something called epigenetics that you will hear much about in the future. And that is the programming first of the different organs in the baby and then of the whole individual for the life to come. And you can see that there are differences in these mechanisms between female and male, the blue and the red fetuses. We were looking then, after studying arsenic in men and women and the skin lesions, we have set up a mother-child cohort of about 2,000 women recruited in early pregnancy. And we studied the effects of arsenic and other pollutants in this very rural and pristine area in Bangladesh. And this just to give you some examples. When we tested the child development, in this case it is the verbal IQ of the children at 5 years, and we related this to the GW is gestational week 8, gestational week 30 exposure. We looked at the exposure in 1.5 years and at 5 years. And you can see that consistently the red dots show much more effect of lowering the IQ because of the prenatal and postnatal exposure to arsenic. We also looked at cadmium because the people eat a lot of rice, and rice are among the plants. All plants take up cadmium from the soil. So we are exposed to cadmium mainly from our most valuable foods, such as cereals, vegetables, and roots. And so we looked at cadmium in the same cohort, and you can see again, this is birth weight. We looked at birth weight, birth length, head circumference, and chest circumference of the babies. And these are about 1,500 babies. And you relate it to the cadmium exposure in early pregnancy. And you can see again that also cadmium affects the females more than the males. And the same when we look at cadmium and the IQ. Cadmium, as I said in the very beginning, causes disease in elderly women. And there's essentially nothing studied on children in early life. And you can see, just like the arsenic, and here we control really for the arsenic exposure, for socioeconomic factors and whatever. You can see again that the red dots are indicating a much stronger effect in girls than in boys on the brain development. So, summarizing a little, I think that we have to look at gender differences in all the studies that we do, whether it's testing in animals or in cells or in human beings directly. But we should also look, and I think it's extremely important, look at early life exposure. When the individuals are developing, they are extremely sensitive to chemicals, and most likely they are giving the different results in female and male fetuses. And if you don't look at males and females separately, and during the development, it's very likely that you have opposite effects. And if you don't look at it, you will see no effect. So, I think that toxicological research or environmental medicine or maybe all medical-related research should have to include the sex and gender aspects. It will do much better research. It will show also mechanisms which may help us a lot to explain causality in epidemiological studies, and also to find means to mitigate or to improve our environment. And I think there is also a right to know. As consumers and as citizens in this polluted environment, we have to know, we should know, whether we are more likely or less likely than the average citizen to be exposed and to have health effects from this, so we can make our own choices. And with that, I thank you so much for your attention.
So thank you very much, Professor Vahter, for that really intriguing presentation. I certainly have a question or two to ask you myself, but we can do that privately, I think. Before moving on to our next speaker, perhaps we can take just one or two very quick questions because of the specialized nature. Yes, just over here.
Yes, not so much a question, but a comment. Thank you very much for your talk. My name is Ineke Klinge from Maastricht University, and I'm co-chairing the Gendered Innovations Project financed by the European Commission, which exactly has addressed this question of how to address sex and gender in research. And we have developed a website which is genderedinnovations.eu, accessible for all of you, and that showcases, I think, 24 case studies in which we demonstrate, we show, we see how integration of sex and gender in the methodology yields new knowledge. And we have one on environmental chemicals also, but on heart disease, on stem cell research, animal research. So I invite you all to take a look at that website and to find the methods for researchers. Thank you.
Is there a question? Yeah.
Hi, Elise Fitzsands from the Institut Universitaire Allemand pour Santé du Travail, the University of Lausanne's Institute for Work and Health. I want to thank you, first of all. This is the most important talk I've heard at women's conferences in years. In 1998, when the Russian Academy of Medical Sciences tried to deal with this same topic, they called it protecting posterity. And the question I have has to do about getting the message out to the general public that is affected by the very pollutants that you are concerned about. What you described, this phenomenon that suddenly there was funding once we knew about endocrine receptors, is the exact phenomenon that happened in the United States when vinyl chloride hit the men, and there was the only emergency temporary standard in the history of the Occupational Safety and Health Administration within less than a year in a system that otherwise takes 5 to 15 years to regulate things like asbestos and arsenic. And my question is, how do we persuade people who think these are very technical and faraway issues that it really has this importance, that in a way, ignoring this, letting it be forgotten, is a kind of cultural suicide? And how do we get that message to a greater public that's told, well, you know, it's technical, leave it to the scientists? Thank you very much.
Just a short comment on that. I do think it's easier to convince the public about this and to describe it. For several of my manuscripts, I've had reviewers' comments that this is not an issue. So I think the proposal previous this morning that all the editors and all the journals should really take this on to require that the gender are looked upon rather than to hide it, as several of the reviewers of my manuscript has proposed. Why study women?
Thank you very much, Professor Vahter.